Good morning. Welcome back to RX Show. We're now live from RX Studio. Today we're going to talk about psoriasis and how MTAC will help patients.
Do you know what is psoriasis? Psoriasis is a common skin disease characterized by inflamed scaly patch and plaque. It is characterized by skin cells that multiply up to 10 times faster than normal. Psoriasis typically causes patches of skin that are dry, red, and covered in silver scales. Some people find their psoriasis causes itching or soreness. However, this condition isn't contagious, so it can be spread from person to person. Being incurable, it may lead to poor patient compliance, especially in treatment which will further compromise the overall management of the disease. Dermatologic problems have significant impact on patient quality of life. Non-adherence to treatment, complexity of drug regimen, development of adverse effects are the challenge in treating patients with dermatological problems. Misunderstanding on the use of various different formulations, such as ointment and creams, is another issue which may affect treatment outcomes. In Malaysia, Ministry of Health have provided MTAC psoriasis service in order to overcome dermatologic problems. Medication therapy adherent clinic psoriasis, or MTAC psoriasis, is an ambulatory care service conducted by pharmacists in collaboration with physicians. The aim is to help psoriasis patients to improve their medication adherence level and also skin condition control. The patient enrolled in this clinic will be followed up for a minimum of 6 visits. They will receive medication adherence assessment, identification and management of drug-related problems, medication counseling, monitoring of clinical outcomes, and also dermatology education by the pharmacist. The objective of MTAC psoriasis are first to optimize the benefit of medication therapy in psoriasis patients, second to work in collaboration with dermatologists and other healthcare professionals in pharmacotherapy management of psoriasis patients, third to educate patients and encourage the appropriate use of psoriasis medications among patients, next to increase patient adherence towards psoriasis medications, and finally to minimize adverse effect or complication resulting from psoriasis medication or multiple drug regimen. Scope of services provided by MTAC psoriasis are: it will operate in the clinic area during clinic days. MTAC psoriasis pharmacists will perform a multitude of duties throughout the day, such as assessing patients and addressing their needs, documenting interventions and plans, providing appropriate education to patients and caregivers, and completing follow-up. We have minimum of 6 sessions over a 12-month period. The activity at the clinic should be structured according to the suggested workflow and conducted based on the MTAC checklist. There are several steps involved in MTAC psoriasis workflow. Patient who comes to dermatology clinic will be registered first. After that, the patient will meet the dermatologist and undergo screening process. The dermatologist will review the patient problem and then decide the suitable treatment for the patient. After meet the dermatologist or other healthcare providers, the patient will be assessed by pharmacists. During the initial visit, the pharmacist will perform an initial assessment of the patient. The initial evaluation will involve the review of patient medical and medication history, assess of patient medical and medication history, assess of their social and family history, assessment of their diet and lifestyle, assessment of allergy, assessment of side effect or toxicity of past medication, and then assessment of medication knowledge, and also assessment of medication adherence, and then review of laboratory values and relevant tests, and then determination of medication-related problems and issues, and also followed by the patient or caregiver interview. During the initial interview, the pharmacist will introduce herself first, and then the pharmacist will explain the objective of MTAC psoriasis to the patient. The pharmacist also will explain the benefit of this service to the patient and tell the goals for patient or caregiver. The pharmacist will explain the patient-specific drug therapy-related needs and goals, and also tell the patient rights and responsibilities in the MTAC program. The pharmacist will briefly overview about the disease and doing assessment of patient medication knowledge. Upon agreeing to enroll in the MTAC program, the patient will sign a participation agreement, this allowing her information to be released or shared with other healthcare provider involved in her care for the sole purpose of providing critical information needed for coordination of her care, unless her advice is otherwise. The patient's caregiver or relative are strongly encouraged to attend the MTAC session together. After the initial interview, the pharmacist will schedule the patient's next MTAC follow-up based on the need of assessment after the first visit, the patient's current health status, or other clinic appointment and medication refill appointment. The pharmacist can also proceed the first visit module depending on the suitability of the clinic setting and time. For second and subsequent visits, the patient's subsequent appointment should be based on the patient's next clinic appointment date or pharmacist appointment. However, MTAC psoriasis appointment date may be rescheduled based on the following reasons. The first one, a change in patient's medication. Second, patient experiencing serious drug adverse events or toxicity. And third, other reasons as determined by the pharmacist that warrant a follow-up.